So I'm doing non-Hodgkin's lymphoma, and the reasoning for me to pick this one was because we recently lost someone that went to my school last year to it, and I wanted to learn more about it. So the definition of it is a form of malignant lymphoma distinguished from Hodgkin's disease only by the absence of binucleate giant cells. So it's cancer that originates in the lymphatic system, and that's the disease-fighting network spread throughout the body. And tumors develop from lymphocytes or white blood cells, and they can develop in your lymph nodes, bone marrow, spleen, and thymus. So non-Hodgkin's versus Hodgkin's. The main difference is that non-Hodgkin's is way more common than Hodgkin's is. Non-Hodgkin's is 61 types and Hodgkin's is only 6. And like the main difference, I guess, would be that Hodgkin's is less common and it's usually less dangerous or less curable. For my first incidence, I did number of cases per 100,000 people by race, ethnicity, and sex. 24.9 men per 100,000 people will have this disease, and 17.2 women per 100,000 people will have this disease. And I thought it was interesting that it was more common in men than women, and it was more common in the Caucasian descent. My second incident was number of deaths per 100,000, and the number of deaths was 6.3 per 100,000 men and women per year, and that was based on all sexes and all races in this, and the percent of deaths is highest among people between the age of 75 and 84. So etiology, the cancer seems to start from an abnormal cell, and it's not really clear why it becomes cancerous. Normally lymphocytes will go through a predictable life cycle where all lymphocytes die and your body replaces them with new ones. And if the abnormal cell survives, it will multiply and make more abnormal cells, and this starts in your T cells and B cells. So your T cells are the workers that kill foreign invaders. Only 15% of non-Hodgkin's lymphoma, are in the U.S., or 15% of it. And there are subtypes that are precursor T lymphoblastic lymphoma or leukemia, which I'll talk about in a second, peripheral T cell lymphoma, cutaneous T cell lymphoma. So precursor T lymphoblastic lymphoma or leukemia is in young adults, usually men rather than women. And if it hasn't spread to the bone marrow yet, then it's usually can be cured, and it's found in the thymus where T cells are produced. So how much bone marrow is involved depends on if it's leukemia or lymphoma. A lot is leukemia, a little is lymphoma. B cells, they make the antibodies that the T cells will attack with, and most lymphoma arises from B cells, and it's 85% in the U.S. Subtypes include D-cell, large B-cell, diffuse large B-cell lymphoma, which I'll talk about in a second, follicular lymphoma, and mantle cell lymphoma. So diffuse large B-cell lymphoma usually get in your mid-60s. 3 out of 4 people have no signs after the initial treatment, and it's usually deep inside your body, in your chest, abdomen, or in a lymph node in your armpit or neck. So the signs, they're kind of like flu-like signs. So if you have breathing problems where you have wheezing or high-pitched sounds, coughing, swelling in your head, neck, upper bodies or arms, trouble swallowing, painless swelling of the lymph nodes in your neck, arm, underarm, stomach, or groin. You can have fever for no reason or weight loss for no reason, and night sweats. Symptoms are similar. They're also flu-like. So you can have night sweats where you're soaking your bed sheets or your pajamas. Fevers and chills, they come and go. You have itching, you have swollen lymph nodes in your neck, underarm, groin, and other areas. Weight loss, coughing, shortness of breath if it's affecting your thymus glands or your lymph nodes in your chest because it causes pressure on the trachea. You can have abdominal pain or swelling, which can cause loss of appetite, nausea, or vomiting. You can also have headache, concentration problems, or personality changes. So diagnostic tests, you can have physical exam and history, which is just general signs where it checks for lumps or unusual things. It also checks for health habits and past illnesses and treatments. Another one is biopsy, and that's removal of cells and tissues, and they get looked at under a microscope by a pathologist to check for signs of cancer. And you can have excisional and incisional biopsy. Excisional removes the entire lymph node, and incisional removes part of it. And then you can have mediastinoscopy, which is surgical procedure to look for organs and tissues between lungs for for abdominal areas. You can have anterior mediastinotomy, which is surgical procedure to look at organs and tissues between lungs and between breastbone and heart for abnormal areas. And thoracentesis, which is removal of fluid between space lining of chest and lungs. You can also have things like ultrasounds, CAT scans, PET scans, chest x-ray, or lumbar puncture. So this is bone marrow aspiration and biopsy, and that's the removal of bone marrow, blood, and a small piece of bone. And you insert a needle called a Jamshidi needle, and that will do that for you. And the tests that you get from that will include cytogenetic analysis, flow symmetry, immunohistochemistry, and immunophenotyping. So cytogenetic analysis is a lab test in which cells in a sample of tissue are viewed under a microscope to look for certain changes in a chromosome. Flow symmetry is a lab test that measures the number of cells in a sample, percent of live cells, and characteristics of a cell like size or shape, and the presence of a tumor markers on cell surface. So the cells get stained and with light-sensitive dye, and they're placed in a cell fluid, and then a laser's passed in them, and then it's measured on how light-sensitive dye acts to the light. Lumbar puncture is where you remove cerebrospinal fluid, and the spinal fluid is sent to a lab to be tested, and it's also known as a spinal tap. So treatment depends on 4 things: the type, stage, age, and symptoms. So type could be non-Hodgkin's versus Hodgkin's. Stage could be 1, where it's early disease, where it's only found in 1 lymph node, 1 organ, or an area outside a node. 2 is locally advanced disease, where cancer is found in 2 or more lymph node regions on one side of the diaphragm. 3 is advanced disease, where cancer involves lymph nodes both above and below diaphragm. And 4 is widespread disease, where cancer is found in several parts of 1 or more organs or tissues in addition to lymph nodes, or is in the liver or blood or bone marrow. Age, for an example, precursor T lymphoblastic lymphoma or leukemia, like I was talking about earlier, is found in young adults, and diffuse large B-cell lymphoma is found in like mid-60s. And then symptoms, weight loss, fever, and night sweat seem to be a very common one. So the treatments you can get are those ones. So radiation therapy is where they use high energy X-ray to kill cells and keep them from growing. External radiation therapy is where they send radiation toward the center, and internal radiation therapy is where they place it directly into or near the center of the place. And chemotherapy is where they use drugs to stop growing of cancer cells, either by killing cells or stopping them from dividing. And they may add steroid drugs to relieve swelling and inflammation. High-dose chemotherapy may be given when non-Hodgkin's lymphoma returns after treatment doesn't respond to the first treatment. And then they'll use a stem cell transplant where you use your own stem cells to reduce or to rescue the bone marrow after the high-dose chemotherapy. Also targeted therapy, where they use drugs or other substances to identify and attack specific cancer cells without harming your normal cells. Plasmapheresis, where they remove extra plasma and antibody proteins from blood, and normal cells will be returned into your bloodstream with donated plasma or plasma replacement. Biologic therapy uses patients' immune system to fight cancer. Interferon is a type of biologic therapy that affects the division of cancer cells and can slow tumor growth. And watchful waiting, where you don't do anything until you see signs or symptoms in a patient. And then control measures, there's no way to prevent it. It's not hereditary. No one really knows what it's from. The risk factors are aging and suppressed immune system, and you can also possibly reduce your risk by avoiding obesity and HIV and AIDS. So just stay healthy and take care of your body is all you can really do, because you can't really prevent it, or you can't really get it from your parent or anything. So this is a visual of stage 1 through 4, where it's in 1 spot, and this one's in 2. This one's on both sides of the diaphragm, and this is in multiple spots. That's an X-ray of a mass. That's a swollen lymph node, and then these are the places affected. And then I thought it was interesting that it was number 7 in common cancers, and 4.3 of new cancer cases in the U.S. are non-Hodgkin lymphoma. So yeah.